Hi, Kevin.
Oh my gosh, hi Kevin. Good to see you.
How do y'all know each other?
We have a mutual friend here in Seattle. Uh, yeah, it just purely coincidental. So, I mean, medicine's a small world too, you realize.
All right. Okay. So welcome everybody. Thank you for being patient with us. We're so excited to host our event today. So this is SHAPE, Student Health Workers Against Predatory Economics, presenting our panel discussion on unionizing doctors and why labor organizing makes sense for healthcare professionals. We are incredibly lucky to have with us today three panelists. We have Dr. Josh Stein, who's an EM resident doctor at Stanford Healthcare and part of the Stanford Housestaff Union, which is associated with the Committee of Interns and Residents. And then we have both Dr. Kevin Steehler and Bryce Walker from the Resident and Fellow Physician Union Northwest, based on out of the University of Washington. Dr. Steehler is an internal medicine resident and lead negotiator with RFPU, and Bryce is a staff organizer with RFPU. So we're thrilled to have all three of them with us, and we're going to have a cool discussion that hopefully students will carry with them going into residency in the future, and others will, take something valuable away from as well. So I'm just going to throw it over to our panelists first. Maybe we'll start with Bryce, then Kevin, then Josh. And can you just do very brief, tell us a little bit about yourself and how you got involved with labor organizing?
Thank you. Yeah. Hi, everybody. Good afternoon, evening, wherever you may be in the country. My name is Bryce Walker. I use he, him pronouns. I am the membership manager for RFPU Northwest, which is the Resident and Fellows Physicians Union. Just as David said, out of the University of Washington up here in Seattle. I got into union activism about a little over 10 years ago. First, I come from a union household. My father was heavily involved in his union, still is as an active retiree. But my story's simple. I had a workplace issue. I called my union rep. He had it fixed in 24 hours. And I said, well, there must be something to this more than just paying my dues. So I just got involved and went to every single union meeting I could, went to every rally, held every sign I could get my hands on. And then I got the opportunity to become an organizer with SEIU, Service Employees International Union. I'm sure many of you have heard of them. And I was an organizer with them for 5 years. And I made the jump to help organize and change the predatory economics, as to steal part of your name, for resident doctors. I'm very happy to be here. I'm so excited that there's this much interest in organizing. I'll kick it over. Kevin, do you want to go ahead and go next if you're ready?
Yeah, sure. And we are so lucky to have Bryce in our union staff. He has so much experience. But my name's Kevin. My pronouns are they, them. I'm a second year IM resident at UW and the lead negotiator for RFPU Northwest. I grew up in Erie, Pennsylvania, went to medical school at Emory in Atlanta, Georgia. And I got involved. This is actually my first union I've ever been in. So I've only been in the union for 2 years and somehow ended up being lead negotiator. But it was kind of peak COVID times when our last contract was being negotiated, and I watched the negotiations as an incoming intern to UW. Right before I was moving, I was accruing a lot of credit card debt from the moving process and renting in Seattle and having to put down a security deposit on an apartment, all of the things that fourth-year medical students accrue debt from, and on top of all the debt that we have for student loans. I've always been a little bit, a little bit pre-radicalized and wanting to see a lot of change in medicine, like a lot of people in our profession. So watching those negotiations made me angrier, and decided to channel that into becoming a board member. because I saw there was a position open, and got elected and continued to get more and more involved, and finally just now I'm lead negotiator, and we're in the midst of a negotiation as well, for our contract expires July 1st. So that's me. I can pass it over to John.
Hi, everyone.
Josh, sorry. We're just meeting.
That's okay, Kevin. Hi, everyone. I'm Josh. I'm actually graduating EM resident this year at Stanford. I initially got involved with union organizing last year, and maybe some of you may have heard of what happened at Stanford last year, but there was a big debacle with our vaccine rollout for all of the employees at Stanford. They created an algorithm with like a closed door committee on how to allocate vaccines, and they in their like initial wave of 1,000 vaccines that they were giving, they included actually initially 0 house staff, realized 2 days before included 5 house staff, and then released it. And then as soon as we got wind of like, oh, none of us are getting invited to be vaccinated, even though we've been voluntold to work in the COVID ICU on our vacations and electives, that we weren't going to be included in that round of vaccines. And so we were very, very frustrated and upset that we had been kind of on the front lines and not afforded this. And so we planned a walkout the day the day we heard, spontaneously all of us texting, and we called all media, and we we did this walkout the next day that made national news, and we got vaccines that weekend because of that. So that's kickstarted. I was pretty involved in that, and that kickstarted off our organizing at Stanford, because we realized that we have a lot of power if we all band together collectively to work on things. And so I was actually the one to email CIR in the first place, which was the Committee of Interns and Residents, which is a large house staff union that has over 20,000 house staff that are members across the country. And ask them if they could help us to organize to join. And I've basically been doing that ever since. And so right now we are in the middle of a union election with the NLRB. We're in the mail-in ballot phase, where we're mailing in ballots to confirm that we want to join CIR. And the results will be announced in about a week or two. So I'm excited to be here.
Excited to have you, and best wishes with the election. I'm sure you'll win. The tide of progress is on the side of labor.
Absolutely.
Thank you, all three.
Oh, I was just gonna say, there's been a lot of recent wins. I don't know if you guys have heard about EVM and Greater Lawrence and a couple other places. So it's a really great time to be organizing.
That's so amazing to hear about. I recently saw today actually some news about Stanford, publishing some ads in the New York Times and I think LinkedIn with union busting info. Anyway, that's a side note, but very related to this conversation. Yeah, so Josh, you already addressed some of these points, but I was hoping to pose a question to y'all about what are the conditions of labor in medicine that kind of show why it makes sense for resident unions to exist, or even exist more, let's say. Josh, if there's anything you wanted to add to what you just described, feel free.
Yeah, there's a lot. I think out of almost any fields, we are in a really unique position. So like to give context, if you look at the data, actually residency salaries have fallen when compared to inflation steadily over the past 40 years. And it's interesting, we provide really a ton of value. It's like very difficult to quantify exactly how much, but every resident, every residency spot is granted like something like $100,000. It depends on the hospital and the situation, but like $100,000 per resident to the hospital from the federal government, and that does not include the value of the labor and the work that we provide to the hospital, which obviously, you know, maybe as an intern, you provide some work, but you don't provide as much, but as you go along, you provide steadily more and more work. And the amount that you're compensated for that work does barely changes. And so, so we provide a ton of value. We are uniquely vulnerable because we cannot just change residencies at the drop of a hat like we might be able to do in a different career. It's very difficult to switch residencies and switch residency spots. And then we, in order to become fully functioning physicians, for most of us, we have to go through a residency program. So if you are in debt from medical school, that is like one of the only ways to be able to like have financial health in your life, is to be able to complete residency and then go on to become an attending. And then we are participating as a whole in this match system, which is the only, as far as I'm aware, the only federally legal monopoly scheme in existence. And so like we are all required to go through the system in order to attain a residency program. Residency programs are required to go through the system by the ACGME, otherwise they're not a residency program. And so you don't get any way, there's zero way to negotiate when you're going through that process. When you get a contract at the end of the day, because you've gone through the match process, you're basically like contractually obligated already to just sign the contract. And so, and this is all based off of the 2004 law that happened. So we're extremely vulnerable, and we have zero negotiating power, unlike basically any other industry. And so it's so important to organize and to work collectively, because that is the only way in which we can attain a voice and power for ourselves throughout this process.
Extremely well said. Kevin, do you have any thoughts to add?
Yeah, that was an excellent summary of why we're uniquely positioned to organize. I just would tell it like it is too, that we are an exploited class of workers. We're the lowest paid doctors and the most overworked. And that also is a patient safety issue. You know, if your doctors are tired, if they're burnt out, if they're suffering, you know, quite frankly, from mental health issues as a result of our working conditions, that's the patient safety issue. And, you know, there's a reason why there's such high rates of depression among residents and doctors who are trainees. You know, so we deserve to have a say in our work environment, and you know, it'll improve patient care. And one of the main avenues of change for medicine, I'm convinced, is you know, when we organize together and we exert our collective power. And you know, we're a large number of doctors in King County, where UW is, and where we serve our patients in Seattle. We're 20% of the physician workforce, and that's 1,400 physicians. So whether people like it or not, like we have the power to have a large say in our working conditions, and we are clearly not satisfied with the conditions of our work as they are currently.
Thank you as well, Kevin. Bryce, I guess from a labor organizing perspective, do you have any thoughts?
Yeah, you're going to hear a common theme about collective power and coming together. and staying strong as one. And that's really the last thing that we have left as working people, to give us a voice, a seat at the table to make improvements in our working conditions, is when we stick together and again make those demands. Looking at it from a purely organizing standpoint from many different industries, at least here in Washington, we're an at-will state. You can be fired for having a bad hair day. Obviously, your boss probably isn't going to say that, but when you have a union contract in place, you typically have access to what's called progressive discipline. You have access to the grievance procedure. There's protections in place for you to be well protected against unfair treatment in the workplace. And again, I can't stress enough that I think this unionization is like one of the last mechanisms we have in place that gives us a say in our own working conditions.
Awesome. Really appreciate it, Bryce. Yeah, I have no doubt. I'm already juiced up. I have no doubt that people will be leaving today with energy around collective power. So please continue to stress it. Okay, so I know another big question we had just in planning the event was we're very curious about kind of what the negotiation process looks like. And so, yeah, can you guys speak to that a little bit, and especially who are you going up against? You know, so is there legal representation, union busting firms that your employers, you know, associate with? And maybe we'll actually start with Bryce this time.
I'm going to put Kevin on the spot. This is a perfect question for our lead negotiator who does this nearly every other week. If you don't mind, Kevin, I think this is a great question for you.
Yeah, so I'm happy to answer that. So as far as how do contract negotiations work, and I think that's the first part of this question. And if you can copy and paste the question into the chat too, if I miss any parts of it. But so basically, you know, we've been preparing for, you know, at least 6 months in advance with all of our contract proposals, getting them ready. And finally, in January, we started negotiating our contract. We do have a lawyer. She is not with us at our negotiation sessions, rather, because that would be expensive. But, you know, negotiations might work differently elsewhere. RFPU is not affiliated with CIR, which is a little bit different as far as resident unions go. We're a smaller union, but you know, we would have the option at any point to do something like that if we needed to. But so far, our negotiation sessions have just been a team of up to 20 residents going into negotiations, and anyone else from our union can join and listen in. But you know, our team of negotiators includes me as the lead, and then we have our executive director, Brenna, who's not a resident, but is helping sort of do, she's kind of like she steers the ship a little bit because we're all pretty new at this, and she has a bit more experience. And then we'll run things by our lawyer before we sign off on them, or we ran our entire contract proposal by our lawyer too. So everything is vetted beforehand, and making sure that we're not like putting language that actually backfires on us. But as far as who we're negotiating against, that is our employer, the University of Washington, and largely it's labor relations who is negotiating with us. And so they're not the direct decision makers of, you know, what will end up being in our contract. You know, when you think about like the levers of power in a hospital system, you know, at the top is sort of your CEO. And there's various other administrative positions that they'll come in and listen in and sometimes weigh in, but they are not always at every session, which is unfortunate because, you know, they should be hearing about what's going on with their residents and what we're experiencing. But basically, the job of labor relations is to say no to everything and, you know, give us as little as possible in our negotiations. So the power that we have at the negotiation table really is only equal to the power we have outside of negotiations, which means like, what actions are we performing? What collective actions are we doing? So I always tell folks that, you know, while it's really important for us to be at these negotiation sessions, it's infinitely more important for us to be organizing and, you know, doing sick, or I guess wellness days, or unity breaks, as we call them, where we took a 15-minute break during like a clinic day. All of us came out onto the streets and did speeches. Those are the things that get publicity and get attention and make your employer, quite frankly, nervous and listening to you. So I don't want to say the negotiations are sometimes performative, but we're not going to have power at those unless we have power outside of them. And I hopefully, let me see, I want to make sure I answered your whole question too. So just let me know.
That was hugely valuable. I think couldn't have been said better, that the power comes from action and, you know, showing your strength as a union. Yeah. So Josh, go ahead, take it away.
Well, so, you know, after hopefully we win our union in the next 2 weeks, then we will begin the negotiating process. So, you know, we're not quite there yet, but we know of some of the challenges already that are in store for us, for a couple of reasons. One, Stanford has definitely hired a bunch of anti-union firms, including their like legal support is Jones Day, which if you're not familiar with their law firm, was also the one that Trump used or hired during the 2020 election for his litigation. So so we are up against probably some of the same type of tactics from Jones Day. And then on top of that, we have seen how they've negotiated with other unions at Stanford. So most of the workers, apart from the physicians at Stanford Hospital, are in unions, and notably the nursing union is extraordinarily strong, which is why they have been able to protect their like compensation and benefits for so long. But they have recently, their contract was like up for negotiation, and the university let it expire. Refused to meet any of their demands about benefits, increasing compensation, safer staffing ratios for nurses, and elected to draw out negotiations. And now they're actually going on strike next week for the first time in 20 years. So, you know, you can't ignore the timing. Like, we're also trying to organize into a union at the same time, and you know, I think that they're trying to shut down negotiations with the nursing union to in part to send us a message. So so we definitely have a lot that we're going to be up against, and I think the first contract in particular can be really challenging because it just it takes a long time, generally speaking, and it's really a realignment of our relationship as a whole with the university, wherein we actually sit down at the negotiating table. So so it I think will be very challenging. So, but I'm looking forward to it, and it's the only way up.
Thanks, Josh. Bryce, did you have anything to add?
Just to kind of piggyback off what Kevin said, you know, the teams that hopefully all of you will end up in a bargaining room with at some point, their job is to tell you no. You're not going to trick them into telling you yes, or trick them into giving you more money at the table. So again, going back to that collective power theme of the day, that's where good contracts are won, are in the streets. And I know there's a question later on about different actions, but again, their full-time job, and they get paid very well to tell you no. That's where you have folks like Kevin who are in hospitals working their butts off day in and day out, and then are also then going to negotiate with them. So again, continuing to harp on that collective power. Again, good contracts are won in the streets, not necessarily at the table. And another thing that's unique for our situation at RFPU, and I've been around unions for many years, as I mentioned before, is we have open and bargaining, meaning all of our members can come and watch bargaining take place and hear how the union negotiates with the university and the university negotiates with us. And that's very unique. So if you ever get the opportunity to sit in a bargaining session or your union has open bargaining like that, I encourage you to participate in that and really see how the sausage is made, if you will, for lack of better terms. I hope that all made sense.
It absolutely made sense. Thank you, Bryce. And you brought up that, we show power in the streets. I did want to pose that question that you mentioned of, what can actions and organizing efforts look like on the ground with these resident unions? Yeah, anyone can feel free to jump in.
Sorry, go ahead, Josh.
Okay. So I mean, we had the experience of like our walkout, which I actually, looking back, is probably one of the like most aggressive actions that has been taken by a group of residents. There almost been no strikes in the history of union residency unions. Not that there can't be, but I think that there is like some pressure for it can be difficult to get people to strike because we have been consistently messaged for years that we have to keep our heads down and do what we're told and say yes to everything and don't complain and don't speak up and stick your neck out. Like that is what you're told over and over and over throughout medical training, and so that can definitely be like hard to fight against, and so it really is like to motivate a group of people like us to do the type of action that we did really took like some sort of flashpoint and a lot of like collective understanding of we are in this horrible situation together, and it is bad, and how can we fix this? But there's a whole range of actions that are not as even extreme as going on strike. Not that going on strike is necessarily extreme, but you can do anything as like small as like a petition, a letter that you circulate. You can do some sort of work stoppage, like you walk out for 15 minutes during the workday, or you do a note strike where you don't write notes for a day or a week, and then the hospital can't bill. And so that's like a direct dig into people's finances without actually changing anything about patient care. So there really is like a lot of options for a collective action. And then like also a lot of institutions, particularly Stanford, really reacts negatively to media presences. Most hospitals want to stay out of the news, and so if you can do something that highlights the working conditions in a very public way, that can really damage like hospital reputations, or make them afraid that will happen, and that is a huge motivator.
Thanks so much, Josh. Kevin, do you want to speak to that a little bit? And it's come up in the chat a couple of times of folks asking about a note strike, billing strike. So yeah, what is your knowledge of that? And it looks like it is something that you're maybe exploring.
Yeah, I think the main thing there's always sort of debates about what action to do next. And it does take some creativity sometimes. But as far as like a note strike, we're trying to find something that won't affect patient care, because a lot of people do end up relying on notes to guide care, especially from consultants. But I think what that looks like will probably be something that is pretty inconsequential for us, which used to be a review of systems, but now that's no longer required for a lot of our billing. So that's kind of out of the not available to us anymore. But looking at other things, which I don't have a great idea of what that will be yet, but it's not an imminent action we're planning. So I don't have much more information to share on it. But we are in the midst of planning a resident wellness day, which was really successful in the past, where everyone plans a wellness day all on the same day. It uses one of our sick days, and it's part of our contract, so it's not violating anything in our contract. People will go see a doctor on that day, or go see their dentist, or take a mental health day, things that we all desperately need, and just to vote one day for that. And I'm very optimistic of how that will go.
Awesome. Very, very exciting. And obviously crucial, right, to always be kind of brainstorming, thinking about what's the next best thing we can do, keep the momentum and the power. Okay, Bryce, is there anything you wanted to add on that front too?
Sure. When it comes to actions, Kevin nailed it. Get creative. I'll give you a story about one of the actions that I'm most proud to have been able to participate in. I was helping organizing security officers at the Amazon campus in Seattle, many of whom were of Muslim faith, and they were not provided prayer rooms or an adequate place to exercise their prayer, or anybody from any faith wasn't provided this area either. All the while, Amazon had full entire floors of buildings dedicated to doggy daycares, and some people were forced to pray on the floors of bathrooms, for crying out loud. So one of the actions we took, that the members took, they weren't members yet, but the organizing security officers at Amazon, they had a pray-in. They took over a courtyard in Amazon, and we had about 50 participants from all different faiths who did a pray-in. The news was there. Many different news outlets from Seattle were there. And lo and behold, less than a week later, Amazon found the space to put in prayer rooms for folks. So you can get creative. One thing I would always caution folks is check the legalities of certain things. You don't want to do anything that may get you sued or get you an ULP filed against you. So while something may sounds so great, make sure you check the legalities. It's best if you have a lawyer handy. Obviously, we know that not every organizing effort will have a war chest that can afford lawyers, but another thing that I would recommend is making sure that you do actions that your members are going to participate in. There's nothing worse than doing something and only having 20% of your members participating, because that doesn't necessarily threaten your employer, right? They now know only 20% of you are doing this. Why should we be scared? So make sure you have something in mind that's going to have your membership get excited about. So that's my last 2 cents there.
Remember that they need you. Like the academic hospital cannot function logistically or financially without residents. It just simply cannot. So if the reason why we have power is collectively, you can't just replace our productivity at the drop of a hat. And so we anything that we do or even just threaten to do is carries a lot of weight if the hospital believes that we will all do it collectively.
Yeah,
So-
and it's a good point with the threat of an action, because you kind of have the most leverage before you've done the action, and you can show them, we have all of these people committed to doing this. What are you going to do in response? So it's really important to get ideally greater than 90% of your membership, but that doesn't always happen. But just getting as many people as involved and talking, board members, and leadership are important, but what matters more are the rank and file members who are having discussions and conversations on the ground, because, you know, I can't talk to everyone. Our board members can't talk to everyone. We need to all conversation, one-on-one conversation is the best way to organize.
If I can tell a super quick story about threatening strike. I was helping negotiate a janitor's contract here in Seattle, and we had bargaining at our office back when we were doing things in person, of course. And we had about 20 or 30 janitors making signs in the lobby saying, going on strike. Janitors are walking off the job as their bosses walked by them. And the contract wasn't settled that night, but there was definitely progress made that evening.
So great to hear. It's an incredible power that those numbers, collective power. Love to hear it. Thank you all three of you. Really valuable stuff. And it's actually kind of a perfect segue into the next direction, which again has been raised in the chat, I believe, a couple of times, which is sort of just about how do you get folks involved? So your fellow residents, you know, whether it's kind of fears that they may have of unionizing, you know, hesitations, you know, how do you assuage those kinds of concerns and, you know, involve folks who may be reluctant, and especially, I guess, new residents too. Every year there's new folks coming in, right? I guess we'll say whoever, go ahead, go for it, Josh.
Yeah, it's definitely a challenge, and something that we've been dealing with for months and months and months as we've been doing like an underground campaign to unionize. Because you know, Stanford, we actually, as far as I'm aware, kept the union organizing effort secret from Stanford since its inception last year until we submitted our cards to the labor board. And so we like managed to talk to like a super majority of residents and like get them on board to support a union effort, just like having one-on-one conversations outside of work, because you're not technically supposed to have like union conversations while you're working, but like you could have them at work, like in a break room. If you're going to be on break and talking about the weather anyway, you can talk about unionizing. But so it was like a lot of person to person, like talking about the issues and talking about why a union might help us to overcome those issues. And it's really hard to have those conversations with people that you don't know. And so a lot of the work that that we did was kind of like building out our community from the core group of people that were like initially super passionate, you know, on the organizing committee, and just like slowly get more people involved and find more people that want to do parts of our organizing process, and then using those to find more connections and to talk with more people. And at the kernel of all this was just one-on-one conversations with everyone about why we need a union. And there's always going to be some sort of thing or issue, because that you can find as sort of a common ground about why a person might want to unionize, because we're all exploited. And that's true at Stanford, that's true at every institution across the country as a class of workers. So you're gonna find a way to motivate people. You just have to ask, and having those like one-on-one conversations outside of work to motivate people, or to find those things will really like form the basis of any type of action campaign. And really just like our union as a whole is like formed out of each of these personal relationships. And so that is like I think really the way to go about it. And, you know, I would imagine, we haven't done this yet, but we're going to, assuming we win our union, like start this process next year with incoming interns, where we, as we get to know them, will again have those conversations and be like, this is why we formed you, and this is why we have it. This is what we're negotiating for. What do you want? How can we make your experience better? And I imagine that will form the basis of the support. The other thing too is, like, if you're going to a program that has an established union, as many of the fourth years may have already seen, many places actually like hand out, like I think at the UW I got like a union flyer during my like interview day, and so like, you know, that you're going to a unionized program, and so hopefully people have chosen that program in part because they do have a union.
That's really cool. Yeah, I had not had that thought before, but that would be very attractive to an applicant like myself. Yeah, so obviously it's a slightly different situation at Washington, but what's that been like? Kevin, maybe, and then Bryce.
Sorry, the question was about like,
Just-
how do you get people to on board?
Exactly, yeah, and
Okay.
especially folks coming in,
Yeah.
you know, new residents.
I think from our perspective, once, you know, our unions existed since 2014, and so you know, you can highlight the accomplishments of other unions if you're trying to get people involved, but also highlight your own accomplishments if you're already in a union. So, you know, we've won things like an extra week of vacation, which is like, I never had to live with 3 weeks of vacation in residency, which I'm very happy about, because 4 weeks, you know, I'm sure feels a lot better than 3. I also like use our public transit that we won in our last contract negotiations like every day. I never have to pay for the bus. You know, we're working on several other things with our current contract negotiations, like getting a relocation stipend for incoming interns, and you know, increasing our childcare funding, increasing our salary, which is one of the most important issues of our members. So you know, highlighting the things that, you know, people stand to benefit from having a union is one of the major things to entice folks, and all the benefits that we've won greatly outweighs what members will pay for their dues as well. So it pays for itself in a way. And then I'm also looking at this question that Amber submitted about, you know, what if people just want to get through the next few years? Well, what if residency didn't have to be something we just get through? What if it were actually enjoyable, and you know, the training process actually, like, you had time to maybe save some money or start a family, or whatever you want to do with your life. You know, we live in this culture of like, you have to suffer through your medical training. And, you know, I really strongly believe that, you know, unionizing and organizing is the way out of that. And just because, you know, our attendings had to go through this doesn't mean that everyone thereafter must also go through this hazing process. Like, it's really become that, and, you know, it's not fair. And I also do think of it as like a major barrier to change in medicine as well, if our trainees are just kind of the brunt of our workforce and being exploited.
And I think it's like not just about you know, like trying to secure more wins, but once you've had those wins, to make sure they don't get taken away. Because you know, without a union, even if you can get your institution to, you know, get you XYZ benefit or whatever, there's really nothing stopping them from taking it away ever. Without your collective power, without a negotiated contract that legally prohibits them from taking that away.
I'll go ahead. What Josh said early on in his statement about having those one-on-one conversations, those we call it those boots on the ground peer-to-peer conversations is so important to organizing. We can send out 50 emails a week and all these text messages, but nothing substitutes having those one-on-one conversations. And from an organizer standpoint, when you have these conversations, the most important thing is finding the issue that moves a person into action. That right there is really the key to organizing, and it's a lot easier said than done, I promise you that. But again, finding that issue that will move a person into action, and it's going to be different for every person. When I have those conversations, I try to not go straight to the dollar amount, right? Because as we look at Jeff Bezos, you can have all the money in the world and it's still not enough. But things like not being able to afford healthcare for your son or daughter, having to choose between groceries and rent, those are issues that are going to, I would presume, move somebody into action. So that should kind of be the core goal of every conversation you have while you're organizing, is finding out what's going to move this person to action. And I do want to also mention, there is going to be retaliation from your bosses, especially when it comes to new organizing, as Josh can probably attest to and maybe have seen through their efforts. And it's good, I guess, for lack of better terms, to inoculate the person you're talking to. You might get sat down by the boss. You might get written up because you're signing this union authorization card. You may get fired because you're signing this union authorization card. It's okay to have those upfront inoculating conversations right off the bat, again, because if these things happen and you said, oh no, you're fine, you can sign this card, this authorization card, you don't have to worry about anything, and then they get fired, right? There's always recourses after the fact. But again, back to the point, it's always good to have an inoculation conversation with somebody, especially again in that new organizing setting.
This is really, really awesome stuff. Appreciate all three of your perspectives. I appreciate the stress too on the fact that this is important no matter what. So, I mean, obviously it's great to go to a program where there's a thriving, long-standing union with a lot of strength, and but it's equally important to organize at your workplace that does not have an existing union. These are things that benefit the workers. So yeah, thank you all so much. I think we're going to try to get to a couple audience questions that we haven't directly addressed yet. And one of the first ones, which, hopefully a lot of people here will be interested about, is, are there ways medical students can help in these organizing efforts? Yeah.
I can go. So medical students have the opportunity to show solidarity in our efforts. Follow our social medias, like retweet things that are wrong about our workplace that we're sharing. Just talk to your family members, talk to other healthcare workers, other students. It's really important that the public is aware of these things, because this, our organizing efforts, especially around negotiations, will be publicized and in the news. So the other thing is, I openly get medical students to come to our unity breaks because they're at work with us. So if you hear about some union action and you can get involved, go to a unity break, show your support. So just showing solidarity. And when you go to residency and you don't have a union, start one. That's the other thing that you could do.
Yeah, I mean, I think like starting to think and talk about this like you guys are doing as med students is super important. I, going into residency, knew about the unions that existed and vaguely, and had some exposure as I was going around to different residency programs, but to interview, but generally knew very little, and I had to learn it all in the past year to try to help with the organizing effort. And so like educating yourself like this, talking about it amongst like all of your med school classmates is the place to start as far as like grassroots organizing within medicine. And so, the types of things that you talk about and do, you will carry with you to wherever you go, whether or not they do have a union, and will hopefully make you leaders amongst your peers as far as organizing your colleagues. And then it's a movement that starts always at the bottom and works its way up. We're seeing more and more residency programs unionize. We're seeing actually attendings unionize. There's a couple new attending unions in the Bay Area that just started over the past few years, and that was like essentially unheard of until pretty recently. So you guys are awesome for showing up here. This is the first step in changing our culture, so that we can live a better life and encourage more diverse people to go into medicine and to take better care of patients.
So quick follow-up to that, and maybe Bryce will have some insight on this too. If there isn't an existing union, what kind of at the residency program that me or my classmates end up at, how might you go about looking into organizing one? I think certainly making contact with CIR would be an option, perhaps reaching out to RFPU Northwest. But yeah, are there any other sort of obvious first steps?
I think the first step is obvious. Talk to your colleagues, talk to the residents who are there, and see what the support is to formulate a union. Because again, you can't do it alone. You obviously need majority to win a vote. Hopefully you can get up to super majority and don't have to rely on that last one or two vote coming through. But again, I think that step one is having those one-on-one conversations with your colleagues. And I know that's not groundbreaking information, I'm sure. But I think that's really where it starts. And align yourself with other maybe unions within the area. Go to a picket line and start chatting with other unions in the area, because we will support each other. And obviously they're going to be a wealth of knowledge for you as well. But again, no substitution for speaking with your colleagues first and foremost.
Yeah, if you feel like you have enough support and like amongst your residency peers, then by all means start the process. And basically you can choose to form an independent union like the UW one, or you can choose to go through a existing union like CIR, and you can like partner up like with a local union like Bryce was saying, that can help you to get off the ground. So I think like that first step is probably one of the most challenging. But once you have a group of people who are committed to doing this, either through an existing union or making your own, then the next step is to continue to talk to people and submit cards and support. The process is a little bit different if you're a public or a private institution. I think someone asked about that. The public institution is a little bit easier to win an election because you just need to get you just need to submit cards, and then once you have submitted, I believe it's a majority of cards in your workplace, then that's it. Then you're a union, as opposed to private institutions. What we're going through right now, where you submit cards, and then oh yeah, thank you, Kevin. You submit cards, and then after you've submitted cards, then you negotiate with the institution after it's notified about how whether or not they accept it or not, and they never accept it, and so then it goes on to a election, and then it's like like a secret ballot election that you have to go through. So it's an extra step that a lot of places use to try to union bust. That's when the union busters come in, and then they start messaging, holding captive audience meetings, et cetera, et cetera. There's a whole toolkit that they use that we've been experiencing over the past 2 months. So then once you've like won your election, then you've become a union. So it's a little bit more challenging in a private institution because of that, but there's never been a better time because to do it, because we have a favorable pro-labor majority at the National Labor Board because of the Biden administration. So for years, going through the labor board as a private institution was quite difficult because of Trump. And the leanings of the members of the labor board. So it's a great time, and that's why there have been some recent private institution wins, and hopefully there will be more in the coming months to years. And if anyone has any questions, you're also always welcome to reach out to me personally, and I can put you in touch with people, particularly if you're interested through CIR, which you don't have to go through CIR, but just in case.
This has all been so amazing to hear. I'm personally very energized, and I feel the solidarity coursing through my veins. I do want to be mindful of the time of panelists and all other folks who are here. So I wanted to give the space for any of you to, give some closing remarks, or, plug anything that you wanted to talk about that we didn't get to. The floor is open for y'all.
And thank y'all also for putting your info in the chat. So, if people do have questions, it looks like, yeah, our wonderful panelists are posting there.
Totally up to y'all if you have any closing thoughts.
No, I'm just very enthused and excited about how many people showed up today, and yeah, thank you all for inviting me to this and inviting our union.
I'll say get out there and start organizing, even if it's not necessarily a labor union today. Find what moves you. Get out there, start talking to people. Again, we as a society, we're all we have is each other. So start organizing today.
Yeah, culture change is so needed in medicine, and it starts with each and every one of you. So yeah, whether or not that is through a union, you have the power to band together and to make our life through training better. So I hope each and every one of you goes out and does that. And thank you so much for inviting me. It definitely, it's just such an exciting time on our end, and it's so great to be part of this labor movement across the country and residencies, and well, actually across industries. And so it's really awesome to have the opportunity to talk with everyone across the country about this. So let's fight on.
Truly, it's been amazing and a pleasure to have y'all. Really appreciate your time and energy. Yeah, Caitlin, if you have a chance, would you be able to send the interest form in the chat? So if anyone hasn't filled it out and would like to drop their contact info, feel free to fill that out. But I appreciate all of y'all as an audience asking such thoughtful questions and coming through to this event, again, hosted by SHAPE, Student Health Workers Against Predatory Economics. I didn't introduce myself. My name's Young. And Caitlin is the other host here. Rob is also here, Robert Abhishek. We're the exec board, and it's been a pleasure. I hope everyone has a wonderful rest of your day.